Welcome to the Althing Health Podcast, where discussions with engaging health innovators are shared. In this episode, we will learn more about trauma with today's special guest, Christina Bechtel, licensed independent clinical social worker at Althing Clinic. This podcast about trauma includes potential triggers, such as sexual assault, physical and emotional abuse, historical traumatic events, and conversations of mental health diagnosis. All right. Well, welcome to the Althing podcast. My name is Katja, and I'm excited to introduce today's guest, Christina. Today, she is a licensed independent clinical social worker at the Althing Clinic, and she's also an expert when it comes to trauma-informed care. And I'm really excited to have a conversation with you today, Christy. Welcome.
Hi. This is very exciting. Talking about trauma.
Why don't you give us a little bit of background, talk a little bit about your experiences, your skill sets, and why trauma-informed care is something that you're really passionate about?
Yeah. Well, I guess honestly, it starts like with my own personal journey. Like I, as a child, did experience trauma, but didn't really know a lot about trauma, didn't understand how it affected people. And then, fast forward a couple decades later, and I'm in school for social work. And as I was learning about other people's traumas, things started to kind of click in my head of like, oh, that's what oh my goodness. And I had no idea. And it just like blew my mind of holy cow. So this is what trauma looks like. This is how this is presented in my life. And if I had known that, how might things have been different for me? How might I have responded to things differently if I had only understood how the trauma that I had experienced affected me, not only as a young child, but then as a young adult. And so basically from college level, I just threw myself into learning everything I could about trauma, not only to understand myself better, but in my mind, it was like, well, when I'm a social worker, I'm going to be working with folks who potentially have trauma. And I want to know how I can use my situation, but also this stuff that I'm learning to help them understand their trauma and maybe change the course of what their future could look like simply by being a bit more trauma informed about how is trauma, how has it affected them, how is it currently affecting them, and how might the words I say and my interactions with them be altered so that I can help them better in their journey. And so, I just immersed myself in all things trauma. And then that kind of got me into learning how to be trauma informed and then taking that message and sharing it with everybody I possibly can. Had the opportunity to further my education, become a therapist. So now I'm able to incorporate what I know about trauma and how to be trauma informed in my own sessions to help people start processing through that trauma. So that's a little bit of how I came to be in this work. And I can't imagine doing anything else.
Yeah, that's some really great context here, Christy. And, as we prepared for this podcast, we had different ideas on how to approach this topic. And I think our goal is in today's episode to talk about what is trauma, how does trauma impact mental health and everybody's daily life, work performance, athletic performance, or, just life overall. And our plan would be to have a second conversation where we dive a little bit more into the trauma-informed care aspect and some more details around that. Does that sound right?
Absolutely. I mean, this topic is so complex that, honestly, this could be, a whole year's worth of topics for us. But yeah, we're going to try to condense it. This first one will be talking about the different types of trauma, how that might show up in people's lives, talking about triggers, things like that. And then in our next one, we can really get into what do we do? How are we trauma informed with other people who might be experiencing trauma? Yeah.
Yeah, and as I started looking into some of the statistics around trauma, I was surprised to see that 70% of people in the United States experience a traumatic event in their lifetime. that means it's over 200 million people that we're talking about, right? So what would help me, and I'm probably assuming the ones that are listening to us right now too, is maybe let's start off with what is trauma and what are the different types? Just give us an overview of that.
Yeah. Well, trauma, it's a wound. I mean, it's literally a wound. When we fall down or when we, get a cut, like that's a physical wound, right? We can see that it bleeds. We feel that pain. People looking at us can see that we have a wound. And that's trauma to the body, the outside body. What the type of trauma we're talking about is that invisible wound, something that occurs. It's a traumatic event that happens externally, but can quickly become incorporated in the mind. It impacts then how we show up in relationships. It can impact how, our mental health in terms of the symptoms that we might have because of trauma. There's a lot of anxiety, depression that can come with trauma. It causes extreme stress. It's really a threat to the mind and a threat to the emotional a toll that it takes on us and our nervous system. It's very subjective. It lives in the body. And honestly, it affects everybody differently because I could have an experience with another person and that trauma lands with me a lot differently than it lands with that person. Maybe that person isn't as affected as I am. Trauma, it affects differently based on the experiences that we've had in our lives, right? So, and honestly, it's a lot more common than you think. Trauma does not discriminate. Trauma can affect you no matter your age, no matter your race, no matter your class, your socioeconomic status. It doesn't discriminate. Anybody can experience trauma. And I think something that I have noticed is that folks who experience trauma, like I said, it's that invisible wound. The rest of society can't see it. We have a tendency to give a lot of people grace if we can tell that they're disabled, right? Maybe we hold the door for that person in a wheelchair, or we're okay walking slowly behind somebody that we can see has some physical limitations. Maybe they're walking with a cane, right? But we are not as we don't give as much grace for folks who have experienced trauma because we can't see that disability. We have to take their faith that they've experienced that trauma. And humans don't always do that. Humans don't always like giving grace and trusting that other people are experiencing some internal conflict. And so trauma affects people very, very differently. And we're definitely going to talk about, different triggers that people might experience that have had trauma. We're going to talk about post-traumatic stress disorder, things like that. So that's what trauma is.
Yeah, and we already started touching on the different types of trauma, right? Can you explore them a little bit more and describe what types of trauma do we have? And, like you said earlier, how they might present, what symptoms people might experience.
Yeah. So I talk about 5 different traumas. I talk about acute trauma, complex trauma, sanctuary trauma, vicarious trauma, and then historical trauma. So when we're talking about acute trauma, it's basically a single episode. So something like maybe a car accident, loss of a loved one, death of a pet, right? A divorce. A breakup. It's a single episode. Acute traumas most often happen in like an adult onset. It's usually just one episode, and it's not usually linked to any kind of mental health disorder, right? So acute trauma, just one event. Whereas with complex trauma, now we're talking about probably happened earlier in your life as a child, most often perpetrated by somebody who's meant to be close to you. So if you are a child who experienced multiple episodes of physical abuse growing up, that's going to be complex trauma. It's not going to be time limited. So it's going to happen multiple times over a series of episodes, and it's incredibly invasive. It is absolutely complex trauma absolutely shapes how a person lives in the world, how they function in the world. It can cause significant emotional dysregulation because when you are a young child and you experience multiple episodes of trauma, it alters your flight or fight response. Right? That is how you learn how to live in the world. So you see a lot of emotional dysregulation, difficulty managing feelings, low frustration tolerance, right? Feeling a lot of shame, maybe some emptiness. Complex trauma can also impact like your cognitive abilities. So there's a lot of catastrophizing that goes on with people who have experienced complex trauma. The phrase "don't cry over spilled milk," folks who have experienced complex trauma are going to bawl over spilled milk. It's the worst thing that could potentially happen. No matter what, they go through life always expecting the worst and being pleasantly surprised when it doesn't happen. And that's kind of how they live their life. They're always ready to go, always ready to protect themselves from whatever that trauma is. A lot of it interpersonal difficulties. So again, that ability to be present in a relationship. If you are somebody who have experienced complex trauma, and you experience this trauma from somebody who is meant to be safe, so maybe a parent or a sibling, aunt or uncle, or a teacher or a pastor, right? So if you have experienced this, then that kind of alters your ability to trust. How are you in relationships? What are your expectations of people in relationships? So complex trauma really impacts a person's interpersonal skills. And then, of course, you're also going to see that behavioral impact too. So a lot of impulsivity. You might see some folks who have some suicidal ideation or some self-injury. Utilizing substance use to try to cope with the trauma that they've experienced. Those are all very, very common in folks who have experienced complex trauma.
And you painted a good picture at the beginning of our conversation where you said it's a wound that you can see. And the way I understand when you describe complex trauma, it's, you have scars all over your mind, all over your your soul in a certain way. And sometimes you can have situations where there are additional wounds or a wound opens again, and like I said earlier, you don't see it. So sometimes the society or community struggles with the behavior somebody shows, not being aware of the things they've experienced, especially in such a complex trauma situation that you described.
Absolutely. Because contrary to what people believe, when I introduce myself, I don't say, "Hey, I'm Christy. I've had a ton of trauma," right? That's not how I introduce myself, to give people a heads up that I might, say something that makes them uncomfortable. Like, no, we don't do that.
Yes.
And so, and the idea behind trauma informed, just to give a little spoiler, the number one step in trauma informed care is just realizing how prevalent trauma is, and that you never know what somebody has been through.
Right.
Like anybody, right? That person at the cash register who's not being particularly nice to you that day, like we just look at it like, wow, she must really hate her job. But maybe there's some trauma happening there that she just experienced and she couldn't get off of work. And so our interactions with her could be contributing to that, right? So it is that invisibility is kind of what makes trauma so difficult, because how are we inadvertently continuing that cycle of trauma with somebody that we didn't know was already experiencing it? Yeah. And I think those who have experienced complex trauma are at risk of being re-traumatized most often. Yeah. So, and I mean, folks who have experienced trauma, some ways in which we see this being diagnosed is post-traumatic stress disorder, but there's other mental health diagnoses too, like borderline personality disorder is a huge one, attention deficit hyperactivity disorder, so ADHD, opposition defiance disorder, you often see that in kids, but really I mean, it's a label, right? But all of those things, I guarantee you there's some underlying trauma going on.
Mm-hmm.
So like, if you think as an adult, I mean, it took me till I was in my college years to be able to realize, oh, I was acting that way because of this trauma that I experienced. That makes a lot of sense to me now.
Mm-hmm.
But now imagine that you're a 7-year-old who's experienced trauma, or not even let's go 4, right? Because we know trauma can happen from birth. So you're a 4-year-old, you don't even know how to tie your shoes yet, but you feel the physical effects of trauma. You're being triggered, but you don't have the developmental ability to be able to connect that. So you start freaking out. As a 4-year-old, you're throwing a temper tantrum, and to everybody around you, it's, oh, look at how that child has oppositional defiance disorder or ADHD. But if you reach in and get that story a little bit more, you find, oh, well, that 4-year-old has actually experienced a significant amount of trauma. And if we just alter the way we interact with this child to limit those triggers, we're going to see that behaviors. But we slap a label on it, call it ODD or oppositional defiance disorder, and then you start kind of putting the blame on the kid, and that's not fair, right? So again, it's this idea as children who are experiencing complex trauma and that inadvertently re-traumatizing them because we're not being trauma informed.
Right.
Yeah. Did you have any questions, or should I move on?
Move on. This is great.
All right. And I mean, complex trauma is just that. It is so complex. I mean, there are literally 4-month college classes just on complex trauma because there's so much that goes into it. But we don't have 4 months to do this podcast. So, all right. So the next trauma that I like to talk about is sanctuary trauma. And this is trauma that one might experience in a setting that is meant to be socially sanctioned as safe. So, you know, a medical center in a hospital, somebody who might experience trauma by a doctor, or in a substance use or mental health facility, right? Somebody who's going for help, and maybe something happens there that causes them more trauma. In the corrections facility, in a foster care setting, at a church, in a school, right? School shootings. That is considered sanctuary trauma. You're in a place that's meant to be safe, and then you experience more trauma. So let's say that you have a kid who experienced a lot of physical abuse as a young girl, and she was adopted out to a foster family, and she's there for a couple of years. Everything's great, and then while she's there, she gets sexually assaulted by a sibling. That is considered sanctuary trauma, and just piling on more and more trauma, right? So sanctuary trauma is one that we as medical professionals really need to be careful about, because and why it's so important that we learn how to be trauma informed, so that we decrease the potential to cause somebody to have sanctuary trauma. Vicarious trauma is also something that we as professionals need to be careful for, but this is more how our clients or our patients' trauma could potentially impact us. So vicarious trauma is the experience of learning about another person's trauma and starting to experience those same kind of symptoms that they're experiencing. So if I, as a therapist, have a client come in and they've been through a significant amount of complex trauma, or maybe even acute trauma, and they're sharing those experiences with me, over time, I could become very susceptible to vicarious trauma. And the way that you're able to identify what you're experiencing is vicarious trauma is if you start to notice that certain worldviews are changing. So if you're so exposed to trauma that it starts to change the way you think about the world and how you show up in the world, you might be experiencing vicarious trauma. An example of this one that I like to give is, like, let's say you are somebody, as you grow up and you start to understand the world a little bit better, you are adamantly against the death penalty. You do not believe in capital punishment. And then you become a therapist and you start working with youth or, sexual assault victims. And now all of a sudden you start to think maybe they don't use capital punishment enough. Right? The second your worldview starts to change, it means that you have been exposed a little bit too much to your client's trauma, and you yourself are starting to be traumatized as a result. So that is vicarious trauma, and one that we as helping professionals also need to be very careful of, because that can then impact how we show up for our future clients, for our current clients and our future clients.
How common is this type of trauma? I'm sure that you have some experiences there too, working in the field for, a long time.
Yeah. I mean, incredibly common, especially if you are a provider who yourself has been through trauma, or let's say that you have your own mental health diagnoses, like you are somebody who struggles with anxiety, you are somebody who struggles with depression. If you have those pre-existing conditions already, you are 10 times more susceptible to experiencing vicarious trauma. I think it would be, if you know a provider who has been doing therapy for their entire career and is able to retire without ever having experienced vicarious trauma, I need to talk to them, and they should contact me immediately so I can study them and figure out what is the trick to not getting. I mean, I have some suggestions on how to protect yourself from vicarious trauma. And I have some recommendations on how to handle it if you do know that you've experienced vicarious trauma, you are experiencing it. But to prevent it fully, I don't know. I mean, we live in a pretty rough world.
Yeah, and you make a really good point there. Maybe this will be the third episode of our podcast. I remember a situation where you gave a presentation to an employer, and an employee spoke up and said, I have a lot of client interactions. It was not in the medical field, but they shared that hearing some of the stories that the clients share is really impacting their well-being and their mental health. So I think, we are talking about the situation where a therapist or medical professionals in those scenarios, but I really think it applies to any other, service industry, jobs, or wherever people have close interactions with other individuals, right?
Yep. Yeah, and I remember that one, she was a hairdresser.
Yes. Yeah.
And if you think about it, hairdressers, I'm telling you right now, my hairdresser is basically a therapist.
Yeah.
Like, you get in that chair and she asks you how your day is, and the next thing you know, I mean, it just all pours out. And you would be surprised how many jobs out there there is that opportunity for that vicarious trauma. It's not just for therapists, but it's very prevalent.
And I think we have one other type of trauma left, the historical trauma.
Yeah, historical trauma. So this one is it's the collective and cumulative emotional psychological wounding across generations. So when I talk about historical trauma, so we are talking about folks whose ancestors maybe experienced slavery. Maybe they, Native Americans in the United States were displaced, mass genocide, loss of culture, right? When we're thinking about Holocaust survivors and what they experienced, and then what their children experienced, right? Like being raised by somebody who experienced that amount of trauma, that gets passed down from generation to generation. And so historical trauma is often really invasive. It can generate survivor's guilt, depression, low self-esteem, a lot of anger, some other physical symptoms. But historical trauma is often the one which is disregarded the most. And I'm speaking as a white Caucasian female who I would say that a lot of people have this tendency to minimize clients or patients or students who claim to have historical trauma, because they look at it like, well, you didn't personally experience it, so why are you traumatized? But, and then there's a lot of disregarding it. I cannot tell you throughout my lifetimes how many times I've heard people say things like, why should I be sorry for something my ancestors did? And I personally didn't own any slaves, or I didn't personally steal their land, right? So it's this idea of, I don't want to give them grace because they should just get over it already. This was in the past. It's time to move on. But here's the problem, and I think you actually mentioned something about this earlier, Katya, about the idea of scars, right? So I remember when I was a little girl, I was a huge tomboy. I mean, if there was a tree to climb, I was climbing it. I was on my bike. I was trying to jump rocks. It was not good. I was always getting scratches and scrapes. And the other thing that I loved to do was pick. I would pick at my scabs. And so what do we know about scabs? If you pick them, what happens? It's scars,
exactly. Yep.
Right? And so imagine, if you will, you have a community of people who have experienced historical trauma. So let's take Native Americans, for example, right? 1492, Columbus sailed the ocean blue, right? He came to this country, he decided he liked it, he wanted it, and now he was going to take it, displacing millions of Native Americans, if not more. This idea of kill the Indian, save the man. So we're not going to kill the Indian anymore because that's apparently not good, but we're gonna remove their culture. We're gonna force them into assimilation, and we're talking centuries of trauma that this community has experienced. And again, we like to say, but it's in the past, right? But just in 2021, May of 2021, the remains of 215 children were found on the grounds of the Kamloops Indian Residential School in 2021. So again, it's this idea of, yes, this happened in the past, but there's constant reminders, and that scab is just constantly being picked. And if you pick it enough, it doesn't heal quite right. When you consider Native American reservations, where they're supposed to be able to be sovereign and left alone, right, to be able to practice their own culture, but yet we're going to put pipelines through their homes, and we're going to pollute their air and pollute their water, right? Like cultural appropriation. This is still happening today. They don't get to heal because we still live in a society that continually minimizes the trauma that they went through. Same thing with folks of African descent who experienced slavery. I mean, there is significant evidence to prove how this trauma is being passed down generation through generation, not only through cultural means, but also through things like epigenetics, literal means that trauma literally passes down. So I think to continually just disregard historical trauma as being a trauma that we have to worry about is very, very dangerous. And as a white person, I don't get to look at a person of color and tell them that their trauma isn't enough or isn't a good enough excuse for how they're acting right now, because I have heard people say that. So I think that historical trauma is incredibly important, and we need to do more work around being empathetic to folks who have experienced trauma, whether we believe it to be just or not.
Yeah, and I think, correct me if I'm wrong here, Christy, but it also feels like the different types that you just outlined are intertwined too, right? So I can have historical trauma, I can have complex trauma, I can have, this one-time event that is an acute trauma. So this could be a very, very complex situation there. And you already touched on it during your explanation, but I pulled another stat where it showed that about 20% of individuals with trauma develop actual PTSD. And maybe you can talk a little bit more about the link between trauma and mental health diagnosis, as well as substance abuse as well. And also, when I prepared for this podcast, I wanted to know, what are common symptoms that people experience? How do I feel if I experience trauma, or how might somebody else experience trauma that I might observe, a friend, a family member, a person that I'm connected with?
Yeah. So post-traumatic stress disorder in the DSM-5, which is the book that I just got, and this is the Diagnostic and Statistical Manual of Mental Disorders, and is essentially a therapist Bible. This is how we are able to review diagnostic criteria for the symptoms that our clients are experiencing, and then we're able to give them a mental health diagnosis. Not only so we can know like what therapeutic practices are more appropriate for them, but also, what medications might be appropriate for them, and things like that. So PTSD, the diagnostic criteria for somebody to have met PTSD is to be exposed to death, threatened death, actual or threatened serious injury, or actual or threatened sexual violence. And you only have to have one of these. You have to be experience direct exposure, so it had to have happened to you, witnessing it, so not to you, but you saw it happen, indirectly by learning that a close relative or close friend was exposed to trauma, or repeated or extreme indirect exposure to aversive details. So in order to qualify for the PTSD diagnosis, you had to have experienced at least one of those. So I would say that's, again, it's pretty common. Especially when you're talking about historical trauma. I'll just put that out there. And I wanted to say, because you asked another question too, like you mentioned about how they're intertwined. So let's take somebody again, like let's take our girl that we're talking about that probably, experienced a lot of complex trauma, a lot of physical abuse growing up, and then ended up in a foster family, and now she's experienced some sexual abuse. So now she's got that sanctuary trauma going on. So we got complex trauma, multiple years of trauma. We got the sanctuary trauma, but she's a girl who doesn't really understand trauma. She didn't go to a counselor. She didn't understand trauma. And so as she's growing, she's trying to figure out how to deal with some of these symptoms. So this particular girl, let's say that she was experiencing a lot of anger. Didn't really understand, just a lot of sadness, just this chronic feeling of emptiness, especially because there were things that, a smell she would have or a sound she would hear that would remind her, that would trigger these memories of this trauma that she experienced. And all of a sudden her heart would start to race and she'd have a panic attack, and she had no idea why she was experiencing that, because again, she wasn't able to create a correlation between the trauma she's experienced and the triggers that she's having. She's not sleeping well at night. She's having nightmares. She's having a very dull sense of, nothing quite makes her happy. At this point, she's not even really feeling sad. So there's a numbness of those emotions. This is how trauma really affects the nervous system, is that it numbs your ability to feel certain things, because at this point now your nervous system has been shot almost, because it's constantly going back and forth between fight and flight and freeze or fawn, because what your body is trying to do is learn how to survive, how to make it through this traumatic episode. And so when your body does that for so long, eventually you start to rewire your ability to show up in the world, to function in the world, when you are being triggered. So you have this girl, and as she's getting older and she doesn't understand why she's feeling all of these this anger and this anxiety and this depression, she's not sleeping well, but she realizes that one time when she drank, it made her really happy. And all of a sudden she didn't feel angry, and she slept great that night. And so she's like, well, why don't I just do that? because that is going to make me feel better. And the next thing you know, she's drinking so much. She's drinking every day. She's using all of her money to drink.
Mm-hmm.
She's driving, right? She's drinking and driving. And unfortunately, she runs into a parked car when she's super drunk one night, because again, she's just trying to make herself feel better. And now you add in acute trauma. Because now she's gotten in a car accident, and now when she gets in the car, she starts to feel panicked, because what if she hits something? And her body is sending all those signals to her to try to prevent her from feeling or from getting hurt again. So now you're just adding more and more on. But we're going to drink because we know that's what works. And maybe you become a person who starts trying to use other substances to dull some of those symptoms that you're experiencing. So now you have trauma, you have an alcohol addiction, and now you also have a drug addiction on top of it. Right? So it really does just kind of pile on. But all of it is to keep you happy. I mean, it's not real happiness, right? Like, we know that. We can recognize that using drugs and alcohol isn't actually processing through the trauma in a healthy way. Because in order to do that, what you really need is therapy. What you really need is a medical professional being able to help you work through those memories and process through them, understand why they happen, make those connections between the trauma that happened to you and the way that you're responding to certain things in your life, be able to understand that emotional dysregulation, that cognitive functioning that you struggle with, right? Like, a therapist can really help you process through those things. Medications can help too, but medications treat the symptom. They don't treat the trauma. Medications help you to decrease your anxiety and your depression, but they don't remove the trauma. So I'm a huge proponent of therapy, honestly. So I would highly encourage anybody who is experiencing PTSD or any symptoms of PTSD to find a therapist that you feel comfortable and ready. There are different modalities out there that can really help you process through that trauma in a healthy and safe way.
And you painted a really good picture here, and I think the story helps to put yourself in the shoes of someone who's going through it, but also you might be someone who knows an individual who is experiencing exactly what you just described. So you talked about the triggers, you talked about the common symptoms, you talked about the coping mechanisms that people tend to utilize initially. But now my question would be, if I know someone, a friend of mine, for example, who is experiencing exactly what you described, how can I help them without being a medical professional or a mental health professional?
Yeah, I think the first thing is to just communicate with them what you're seeing. And I would also encourage no accusations, no like, hey, you're being a jerk, you're right, like, you're obviously something's wrong with you, right? Just like, so here's what I'm seeing. It seems like you're a little bit more agitated than usual. It seems like you're experiencing anxiety here. It seems like you get kind of triggered when like, kind of let them know what your observations are. And then ask them, like, are you feeling okay? Is there something going on that maybe you've experienced? Ask them what they need. Don't make assumptions about what they need. That's huge with trauma-informed care. It's not making assumptions, not going, and saying the famous words, what you need to do is blah, blah. Don't do that. Ask them what they think they need. And if they say, well, I don't know, what do you think I should do? Then they've given you permission to go ahead and make some recommendations. I think maybe you'd benefit from therapy. I think maybe you'd benefit from medications. Ask them if they know what the different resources are available to them.
And, in our care approach within Althing and the Althing Clinic, we are really focused on proactive, preventative healthcare, and mental health is one key aspect for us. So our
Mhm.
programs that we run in school districts, with athletes, with adults in corporations, for example, it's really an approach to normalize talking about mental health, and
Mhm.
also giving everybody an opportunity to share what's on their mind and what they might need in a very safe and protected environment, because everything is, under the HIPAA umbrella. And as a clinical provider, we offer a way to have your voice heard. And I think that's something that is really helpful to the community at large, to anybody, right? And maybe you can have a little bit of a closing statement when it comes to, trauma informed care, give a little bit of an outlook on what we're going to talk in our next episode, but really why this proactive healthcare really makes a difference for individuals in the context of trauma informed care.
Mhm. Yeah. So in our next episode, we are going to talk about what triggers look like, what potential triggers look like. We are going to talk about how to start being trauma informed ourselves, not only in if you're a professional and with a client, but also in your lives with your family members, with your friends, with the people you interact with every day. Trauma informed care can be utilized universally, and I thoroughly recommend that people practice universal trauma informed care, because most of us don't go around hoping that we traumatize people today, right? Most of us are trying to make sure that we are being kind humans who don't potentially traumatize somebody. So how do we do that? And in the medical field, and what we do at Althing is we really do focus on taking that trauma informed approach, by kind of making, again, we don't want to make assumptions, but we do want to recognize the prevalence of trauma, so that every person who walks through our door, whether physically or virtually, there's already kind of we know that there could be a story underneath all of that. And so we want to make sure that we are taking a very non-judgmental approach with whatever the concerns are. And then as providers, we want to make sure that we are getting the full story so that we can provide the best medical care possible, and however we need to do that. So we make sure that the questions we're asking are necessary, as opposed to just us being curious, because that's a huge piece of trauma-informed care, is being very mindful about the questions we're asking. But then also making sure that whatever treatment plan we come up with is comfortable and attainable for the patient themselves, because everybody is at a different place in their trauma recovery. Some people may not even, they may know that maybe something happened, but they don't know the details because their brains have repressed it, because that's what they needed to do to take care of themselves and to protect themselves from that horrible thought, right? Other people do know the trauma they've experienced, but they're not able to recognize how that trauma has played a role in how they show up in life, how they respond to people, how they show up in relationships, how they're able to focus it with, work or school or with friends or things like that. So we just want to make sure that we are taking a very whole approach, to taking care of not only the physical body, but the mental health as well. Is that what you were looking for?
Yeah, and also the fact that, coming back to the picture we've been painting, that we are not waiting until these wounds are bleeding like crazy. We want to have a way to stop the bleeding early, and maybe even prevent additional scarring or additional wounds. That's why these proactive programs that we're driving are so valuable. And I think we will touch on, especially our school program, a little bit more in our next podcast, and what we're finding there, and in the context of trauma, and how we can really make a difference there.
Yeah, I think it's so important what we do, because being able to understand the trauma that we have, how that impacts our life, is the first step in being able to control it. Because folks who have experienced trauma, in that moment, they don't have control. over the situation. And so everything that happens after that, whether consciously or not, is a means of trying to control the situation so they don't get traumatized again.
Right.
And being able to get the health care that you need to address that trauma is going to be a step towards controlling it in a healthy way. So.
Yeah, empowering everybody who is interacting with us is also a nice phrase that I'd like to use.
Exactly. Yeah.
Well, thank you so much, Christy, for your time and insights today. I'm really looking forward to our next episodes. I'm going to say plural here because I think there'll be more than one additional one. And it's good to put a light on these topics that are not often discussed, openly. And like we talked about it earlier, I think people can relate. It's very common. We talked about that initially, and I think we all know someone who might be struggling. And now we have some more insights on what we might be able to do to help that individual and be trauma informed ourselves.
Yep. Yes, absolutely. Yeah. Well, obviously you can tell I love talking about this stuff. So, I look forward to our next couple podcasts.
Wonderful. I think we will also put some more links to some resources around trauma-informed care in this description. And obviously, Althing Clinic is a provider who is available to provide trauma-informed care through our provider team. So don't hesitate to reach out in any way there. Thank you again, Christy, and we will talk again soon.
Yes, thank you.
Okay, I'm gonna